My name's Janie Brown. I'm an Associate Professor at Curtin University in Perth in Western Australia, and I have a joint appointment with St John of God Midland Hospital. So our work in palliative care came from a clinician question about, are we meeting the needs of the patients in our care? And if not, what do they need? And how might we be able to meet those needs given the workforce that we have, the skills and knowledge that we have, and the types of needs that the patients have? And so our palliative care research work really started with your more traditional thinking about palliative care and patients presenting with illnesses that we know are life-limiting. So the question that eventually arose was, well, what about the patients that are seeking support for their mental health? Do they have palliative care need? And so we looked into that, and hence this project was born. When we think about people living with a mental illness, we often don't think as thoroughly about their physical health needs, but we know that people living with mental illness also have concurrent physical illnesses like heart disease, kidney disease, cancer potentially as well. What we do reasonably well is we think about the mental health needs of somebody who requires palliative care. So if you present first with a cancer illness, a cancer diagnosis, or say chronic kidney disease, then we might well ask you about your mental health as well. But when a patient lives with a mental illness and then has a chronic illness that might require palliation, we don't tend to think about that quite as quickly. So we were interested in what are the needs, palliative care needs of patients living with mental illness. And we were surprised to find what we found, in that there are many patients who live or have been living with mental illness who also would benefit from palliative care. And I want to make the distinction between palliative care and end-of-life care because it's an important distinction. End-of-life care is care that we deliver to someone we know who is imminently dying, say in the next few hours or days, as opposed to palliative care, which we can implement to support someone's life when we know that their illness will eventually kill them, but it's not imminent. And overlooking those needs in the mental health population is failing to give them the quality of life that they might need in the remaining months or years of their life. So the next steps, I think, for palliative care generally is to start to embed palliative care into general nursing care. So there are really two types of palliative care. There's generalist care and there's specialist care. And specialist care means that we recognise that someone would benefit from palliative care and we refer them to specialists who can deliver that care. But every nurse is the palliative care nurse. Every nurse can start to consider what might this patient's palliative care needs be and what might I be able to do to support those palliative care needs. So I think the next step is to start to think about how we can all assess for the palliative care needs of patients, and we can start to provide some of those. And that's not just in those traditional or more usual palliative care contexts, but also in those contexts like mental health where perhaps we haven't thought about it before. And so I think as a profession, we still need to provide some education and some tools for nurses to include the initiation of palliative care into their day-to-day care provision. We also need to recognise that there will be some workload implications for that. But as we know, when we provide good quality care, we prevent readmissions and other complications that patients may experience. So the return on the investment for the workload and the time spent is certainly seen in other areas of savings. Palliative care is everyone's business. It's not just the business of a palliative care consultant or their team, which may include clinical nurse consultants or nurse practitioners. It really is everyone's business. And so that comprehensive and thorough history taking and assessment of the patient is all of our responsibilities. The initiation of palliative care should be in our general day-to-day nursing care.